Andy, we always knew that this was a temporary appointment, that you were going in to basically try to wrestle this vaccination program in this first quarter of the year, first half of the year, in dealing with the COVID pandemic. Where do you think we are tonight?
Well, thank you for having me on, and it certainly has been a great honor to serve. And look, I think where we sit today, we're not done by any means, but we have all lived through what perhaps may be one of the most spectacular transformations of a country and a country's well-being in a shorter period of time, from the time that President Biden took office, when COVID was killing thousands of people a day, we couldn't produce vaccines, people were very scared and frustrated, to today when we are really have a much more manageable situation, and a situation where if we continue to do what's in front of us now, the worst is behind us. We have plenty of things to worry about, the rest of the globe. We have plenty of problems that we had before the pandemic that we can start worrying about again, but we can start reuniting with our families. We can start moving on with our lives. We can start moving on from this period of time.
Andy, knowing that you were coming in temporarily, how do you feel tonight with what you've accomplished, and how does it compare to the way you felt on your first night on the job? What was your confidence level on your first night on the job that we'd be as successful as we have been so far?
So first of all, I knew I was joining a great team. Jeff Zients, Ron Klain, and the president, who was just so committed to showing the country that if we pull ourselves together and are our best selves, we can do anything. And he was committed not just to that, but to expertise, and he was committed to equity for everyone. And so that was a good feeling. Now, I will admit, Lawrence, it was a very heavy feeling. Thousands of people dying every day, knowing that if we made wrong decisions or didn't act quickly enough, thousands more would die, was one of the heaviest feelings I think many of us have ever felt. I will tell you that the day that we got onto the internet, or I remember getting on the internet and saw a picture of a woman hugging her grandmother, her elderly grandmother, for the first time, it felt like something that so many of us across the country, not of course just in the White House, but scientists, people distributing vaccines, nurses, doctors, frontline workers, had worked so hard for. And that was emotional.
Was it deja vu for you when we were all kind of complaining about how hard it was as we were trying to find appointments in, say, February and March for coronavirus vaccines, and the online system was vexing almost everywhere in the country?
Well, it was really interesting at the time. We were getting pressed pretty hard. Can you fix the technology? And of course, people looked to some of us who'd been involved in technology before. And the thing that I noticed, and the thing that I believed, and I think one of our seminal moments was saying to the public the truth, as we understood it, which was the following: we have a shortage. And I actually got nurses sending me emails and notes saying for the first time they felt things were going to be okay when they simply heard us telling the truth, that we have a shortage. And look, if Amazon.com did not have any of the books you wanted to buy, you would think it was a lousy website. So it wasn't a website problem. It was that we were left with a shortage, and we had to fix the shortage. Once we fixed the shortage, we actually built tools, text lines, and other things for young people, because we anticipated that the challenge wasn't going to be getting people to appointments. The challenge was going to be getting the next set of people to whom they weren't willing to go through all of the trouble to actually get to the system. And that's where we started focusing our technology efforts.
You were steered to the healthcare system when you were sitting there with Jeff Yurkovsky's widow and trying to figure out how to pay those crushing bills. You helped them pay those bills that he incurred on the way to his death, a physician who, when he got that diagnosis, only had 5 months to live. Such a personal and tight and emotional connection to the gravity and to the grueling nature of people trying to deal with the healthcare system. How do you feel tonight about what you've been able to accomplish in these 2 tours in government, and what what you could turn to your old roommate, Jeff, tonight and tell him about what you were able to accomplish.
Well, thank you for bringing that up. I think what you just told is a story that's probably familiar to many, many, many people in this country, which is being faced with the twin challenge of a scary health issue and figuring out how to pay for it at the same time. Now, I will tell you that, they had twin 1-year-olds when Jeff and Lynn lived with us when Jeff passed away. And a year ago, when I was at the end of the Obama administration, I got a chance to invite his then, I think, 15, 16, 17-year-old daughter to the White House for an event. And it was incredible to see her there. But I don't count my experience as particularly unique. Unfortunately, I count my experience as a little bit of the American story. Thankfully, with people like President Biden, with people like President Obama, there's opportunities for people like me and millions of others across the country to get involved, to make a difference, to fix what we don't like, and to show what we can do as a country again. And that was part of what I think this presidency has set out to do, and I know it's going to achieve.